Gender disadvantage and reproductive health risk factors for common mental disorders in women. Name: Hanin Yasin. Introduction. In developing countries, it is very much essential to determine the gender disadvantages and women's health. It can be found through researches that women are suffering from common mental disorders or CMDs. Hence, a thorough research is conducted to the age group of women ranging from 1845 years to the sample size of 3,000 women. In developed countries, it can be seen that the women from developed countries are suffering various mental disorders and anxieties. Additionally, there are several other gynecological problems that women face. Through several research works, it can be seen that women suffers from CMDs or common mental disorders. A sample size of 3,000 women were taken to perform an assessment in order to determine the association of factors which indicates the gender disadvantages and reproductive health that are related with the common mental disorders in women. As per International Statistical Classification of Diseases, there are several types of disorders which are well defined in various forms. This experiment has been conducted in order to derive the increasing rate of human immunodeficiency. Apart from this human immunodeficiency, virus infection and AIDS in women are also being determined. Generally, women face various issues, and among them are childbearing, infertility and menstruations are quite popular. The reproductive tract infections is one of the most important health risk and burden which most of the women faces, and it is somewhat common for all women. Thus, this research was conducted in Goa to determine the relative percentage of women facing these disorders. This experiment helps to build up solutions for these disorders. The outcome in the presence of CMD is 6.6%, and it's a sort of mixed mental and anxiety disorder arising out of different factors. This study actually describes the associations for the two important determinants for the health of women in developing countries. Key concepts: CMDs or common mental disorders are a form of anxiety disorders that nowadays women are facing. According to International Statistical Classification of Diseases, these disorders are defined as form of different diagnostic categories. Gender disadvantages are important for understanding the epidemiological features in detecting the health problems in the underdeveloped countries. In the analysis of the results derived from the experiment, the logistic regression were used. The CMD coded are used as the binary outcome. The participants whose score is 12 or more were regarded as classified as per the cases. Additionally, the common mental disorder was also defined as the cut-off score in CISR. Also, the socio-economic characteristics for the study population are established clearly. Eventually, non-significant factors were also observed for the participants who had limited reproductive choices. Implications of the findings: the initial outcome is the presence of CMD. The CMD prevalence was 6.6%. The outcome is a mixed anxiety and mental disorder arising from various factors. The factors which are associated with CMD are independent, and among them sexual violence by husbands is the most affecting factors that women faces. It was found that the satisfaction of life and self-esteem for the mental well-being. The control of Weiss is absent in the satisfaction of life. The level of physical activity and general health are the result of physical health. Hence, the research shows the factors like reproductive health factors, sexual violence by husbands and gynecological problems affects the health of women greatly, and mostly women from Asian countries are victim of this. Conclusion: the experiment actually brings up the indicative factors related to gender disadvantages, especially for the women whose age group is between 18–45 years. Various factors like sexual violence by husband, reproductive health factors, being widowed or separated, and gynecological complaints like dyspareunia and vaginal discharge affects women largely. This research brings up and explores the gender disadvantages and violence faced by women in Asian countries.